I wanted you to explain some of the research that you've done using the e-noses and the sorts of things that you've applied their use to.
Okay, the main applications are related with the process or that use the human sense of smell as an instrument of analysis, no? So the first or the main field that use the human nose as an instrument of analysis is the food industry, no? You have a lot of industries that produce different food products in the different parts of the elaboration process or storage or so on, use some tasters that analyze the products. For example, imagine wine, beer, different foods, meat, fish, in which the sensory panel or even the enologist or the people from the laboratories of quality analyze, test the product and check if everything is right or not. So in this field, for example, we have worked I did my PhD in wine industry. As you know, the sensory panel in the wine industry is very important because can check if there are defects in wine, for example, oxidation or perhaps some microorganism that generates fails or defects in the wine. So during my PhD, we developed some electronic noses with different types of sensors, with different sampling methods. And we do different tests related with, for example, the varieties of grapes that are used for the wine. We also try to discriminate the aging methods of wine. It is different if you age the wine in French or in American oak barrels, if we have some defects, or tries to detect or to predict the responses of a sensory panel, the descriptors of the wine. When you smell a wine, you say, it smells to this, and this, no? So these responses of the sensory panel, we have predicted by using an electronic nose. We have developed also devices for installing directly in the tanks of a wine cellar. So it is not necessary for the enologist to take a sample and to analyze, because with this system, we can monitor the state of the wine directly from the tanks and in a continuous way. So we can alert to the enologist if we detect something that could be wrong in this process. So in this field, we have done a lot of measurement and a lot of experiments.
I wanted to ask a brief question. So you just mentioned that you're able to use the digital nose or the e-nose to let the ethnologist know if it detected something. Is it also the other way around, that you use these experts and their methodologies for sensory panels, for example, to then inform the e-nose, because they have sensory panel methodologies and what their outcomes, what kind of outcomes they want? So do you use those to inform the e-nose as to what it will be doing?
Yes, well, in fact, we have used the responses of the sensory panel to train the electronic nose to give some responses. So you can imagine an electronic nose like, for example, a police dog, in which the trainers teach the dogs to detect drugs, for example, a person that has been in a place or a lost person and so on. So they train, no? And they give a positive answer, they give a prize, and if not, you try to give a feedback to the dog. In this case, it's more or less the similar, very similar. You can have pairs of inputs, outputs, and the output could change. So you can change how to train the electronic nose by the answers, for example, of a sensory panel. So you can train, for example, to say if the wine has a defect or not, or you can train the e-nose for giving a punctuation between 0 and 100 to give a quality index, for example, or you can train to detect if the wine is from one variety or another one, if you have frauds in the wine. So you can train depending on the outputs that you give to the e-nose.
And have You also use the eNose for medical evaluations, or like you're saying with the dogs, I know there are also cadaver dogs, for example, or drug dogs. Have you worked with this in your research as well?
Yes, we have worked with a lot of people. We have been working in this field for more than 20 years. So we have been working, for example, with the police in order to detect different drugs, explosives, and chemical compounds that could injure the policeman, because they have a problem with the dogs, that the dogs could be tired if they are smelling for a long time. In some cases, it is dangerous for the dogs. So imagine that you have drugs in a car, and if the dogs enter in the car and smell the drugs, they could even die. So they need perhaps another device that could be more robust to this type of dangerous situation. No? Also, it is very difficult with some explosives that in some cases doesn't smell. For example, plastic explosives doesn't emit a lot of volatile compounds that could be detected by dogs, and we have been working with the police in this aspect. We have a student that did PhD in detecting different diseases through the human breath, because we emit in the breath different organic compounds that are biomarkers of different diseases. So if we could develop a device for detecting these diseases, it could be very good for them. No, there are devices that could be found in hospital, but what we try to develop is like a personal device. Imagine that I have a disease, for example, asthma, and for different reasons, I could have an increase in my illness. So I have to go to the hospital, I have to go to the fair to do a test, then to go to the doctor, he sees the analysis, and it has a very high cost. And if I had, for example, a portable device in my house, I could blow into this device, and this device could analyze my breath and send directly to the doctor, and the doctor could see the concentration of the compounds and gives, like not in real time, but very, very few, a response. And for example, I have to take a pill and or so on. So this is another interesting application for this type of devices.